The world continues to react to the emergence of the latest COVID-19 variant called the Omicron variant. Many countries are reevaluating their procedures at airports. Recently, Canada's health minister said the rollout of new rules at airports will depend on the capacity to immediately begin testing arriving air travelers. Meanwhile, as researchers continue to learn more about Omicron, the WHO warns that travel bans are having an impact on global cooperation efforts around the new variant. This is by delaying shared laboratory samples from South Africa, where the variant was first reported. Well, joining us now to tell us more about what we know so far about this new Omicron variant is Dr. Robert Hecht, professor of clinical epidemiology at the Yale School of Public Health. Doctor, welcome to Forum Daily.
Thank you very much.
Now, how does the Omicron variant compare to the other variants of COVID-19 that we already know about?
Well, there's still a lot we don't know about the Omicron virus. We do know that it's highly transmissible, and that's the most frightening, most worrying thing about it. We know that it's many hundreds of times more transmissible than the earlier variants, the Alpha and Delta, even the Delta variant, which has spread so widely. So this is a great cause for concern. What we don't know and what we need to find out as soon as possible in the coming days, we certainly hope, is how severe the illness is connected with Omicron infection. We don't know if a person who's infected is more likely to have severe illness and respiratory symptoms and failure and require hospitalization and face the threat of death. It could turn out that Omicron is relatively mild, even though it's very infectious. The other thing we don't know about it yet is how well the current vaccines that we have at our disposal will work to prevent breakthrough infections of the kind we've seen with Delta. We don't know how often that's going to happen with Omicron.
So there's lots to still find out about the Omicron variant, Doctor. Well, there is talk about implementing nationwide booster shots of COVID-19 vaccine to counter this. But how likely is this going to be our last dose of COVID-19 vaccine?
Well, we'll see. My colleagues and I have been anticipating that boosters would be needed for some time now, even before the first countries like Israel moved to the booster program. And here in the United States, where I live, where the program started out mainly targeted at those over the age of 65 and rapidly, as we expected, expanded to all those who are currently eligible for the first round of vaccine. So this was something we expected. We saw that the initial doses that people were receiving back in the winter and in the spring were starting to wane. And this is not surprising. We have this with other vaccines that we give to children against childhood illnesses of one kind or another, against diphtheria, tetanus, pertussis. We have to boost them several times. We do this for a wide range of vaccine preventable illnesses. So we're not surprised. Whether another round of vaccination will be required, or even whether we may be looking to the vaccine companies to develop new versions of their vaccines that are better targeted at Omicron. This is, again, one of the things we're going to find out in the coming months. But I think everyone now who's been facing COVID, who is concerned about her or his own health, that of their family and of their community and of their nation, realize that we need to buckle our seatbelts metaphorically and be prepared for unknowns and for a rough ride. So one of the things we need to combat here is a sense of fatigue or desperation on the part of the population, people thinking that with a single dose of a vaccine or even a double round that things are going to be fine, that it'll all be over. I think we have to be prepared to be in this for the long haul and to accept the fact that we still don't know certain things about this virus, how it changes, and we're still improving the arsenal of vaccines and drugs to deal with both preventing infection and minimizing the negative health effects of people who do become infected.
All right, Dr. Robert Hecht, thank you again for joining us today on Forum Daily.
It's a pleasure. Thank you for asking me.